All right, so yeah, Kay and I are twinning. Yeah, we are purpling.
Yeah.
We are
You are
purpling.
women, you know, so yeah.
Yes.
Everything with
I don't know if our viewers remember.
Everything.
Yeah, I don't know if viewers remember, but last week Tuesday, when you saw me in purple and I said that it was a purple month, you said next week Tuesday you're rocking purple. And yeah, KMJ did. Very beautiful of you to come.
God bless women, man.
Amen.
You guys go through a lot.
Yeah, we do.
God bless you.
Yeah, we do. Anyways, guys, so my name is Asiadua Akumia, and I'm here with KMJ.
Yep.
Yeah, so we are climaxing the conversation on preterm babies. The entire month, we have been pushing the awareness of preterm babies, and it's been beautiful. It's been amazing. Well, we had preterm mothers of surviving preterm babies come in to share their stories, and last week we loved it. Selena, you missed that one last week, though. Nancy's story. Yes, you heard about it, right? Yes. And we are glad to have her here again. Nancy Nani is here again with us this morning. But then something incredible has been going on. Something incredible has happened. KMJ. So Selena Bintum has been doing very well. We need to give her flowers when it comes to preterm babies. I'm telling you, she's done incredibly well, and I don't know, but then the very first Tuesday in the month of November, she shared her story and she shared the reason behind, what she's doing, and she mentioned that it wasn't even about what she had gone through, but the fact that she didn't want to see other women go through all of that. So, Selena, thank you so much.
Thank you.
You've done so well. Now let's talk about the Purple Basket. Off air, you were talking about it briefly. So for the sake of viewers who wouldn't know what really the Purple Basket is about and what you and the foundation have done, please let's get right into it.
Well, good morning to your viewers and for everyone who has followed this conversation keenly and participated. I was speaking at a seminar last night, and when I was done, one of the women came up to me and said, you probably might be the person that I watched and listened to on Joy Prime or maybe Joy News. And she remembered the conversation.
Right.
That is how powerful the advocacy or awareness we've done the last 1 month can do. That people remember the story. She said that, now I know what to do and how to help somebody else if this happened. We have created a notion that this happens to women, but it impacts the man, the family. So KMJ, did I get it right?
Yeah, that's true.
If your loved one, not necessarily romantic, but immediate family member suffered preterm birth, you would feel it too. The cost, in case there are complications, God forbid, you would also experience, what it means for a baby. Your loved one is going in and out of the hospital, and all of you have to contribute the reproach, they have to beg.
Even the emotional stress.
That is exactly what I'm
transferred to you immediately because you're there for the person.
Beautiful. So this is not just about women. It's about everybody because it affects all of us. And its social impact and also economic impact on this. And again, I have to also give you your flowers. You've done amazing. Joy Prime, Joy News, multimedia family, you have done incredibly well. Given organizations like us, African Foundation for Premature Babies and Natal Care, opportunity to not just have an idea on the shelf, but birth it, that we can impact lives. Now, people are empowered, people know more. And so for every Tuesday that you come here, sharing this information and pushing yourself, I see how all the time you literally make sure that you are a part of the conversation and you feel it. The feedback we are getting is amazing, and thank you so much. Now, before we come into Purple Basket, if you'd allow us, the entire month, we did this with Joy Prime, we also held the summit, the second Purple for Prematurity Summit. Now, this is the second edition. It's a national advocacy platform, a multi-sectorial one, which means that every sector whose responsibility or work impacts newborns, mothers, and families. We brought all of them together. Now, the goal here for this year, we said that we were advocating for increase in investments for newborns to give preterms a brighter start. And it was amazing. Well attended, well represented by all sectors from healthcare, community to industry, or is it those whose services and products targets our group to inspire innovation. You remember issue about malaria?
Yeah.
15 years ago, if you had malaria, you'd be alarmed.
Yeah.
Just the thought of getting chloroquine injection, you would even get up from and how you would eat.
Yeah.
But because of the awareness and awareness sparked advocacy, and advocacy led to action, research and investment. Now, when somebody has malaria, you are not as alarmed.
It's almost a normal thing.
It's almost a normal thing.
Yeah.
So that is why we had this summit, and it was impactful, and we extended it by support of Joy News. We had a national dialogue. We brought who is who on the national platform.
I watched it.
You watched it?
Yeah.
And it was amazing.
Great insight.
Great insights.
Yeah.
And guess what? Hopefully tomorrow, we are presenting a call to action statement to the Parliament Select Committee on Health to push this, because the conversation shouldn't end.
Yep.
Yeah.
We are going to present this and make sure that we lobby through with governments to learn how we can encourage public-private partnership to increase investment in this space and the immediate action that government can take. Because after this conversation, we will not sit and wait for it to be business as usual.
Yeah.
Because we will not wait, if we wait till next year to now get AJ and KMJ, it would be almost as if we didn't do anything. So we will hope that...
You just called me AJ.
No, I'm sorry. I take that back.
No, you shouldn't take it back, because actually in university they used to call me AJ because I'm Ajwa.
Oh,
So you so spot on.
oh, right. I thought I didn't mention. Well, I'm sorry.
You're so spot on.
So I mean,
Yeah.
AJ, I will probably learn your name right. Make sure that I don't call you the familiar name that your viewers are.
Yeah.
But you've done amazing. Is what I'm saying, that we want your effort next year to look at what we've done right.
Yeah.
So next year, when God willing, we are live and we are talking about this, we need to say that last year, following this advocacy, this is what we achieved. So that we have something to celebrate and still highlight the challenges and the milestone. So I will go into Purple Basket if you would like me to.
Okay. All right, but before that, Nancy.
Yeah.
Hi. You know, last week you trended, right?
Yeah.
And she has a beautiful hairstyle.
Yeah.
Yes, she really does. You know, your story that you told us last week, the most outstanding part for a number of us was the support that you got from your husband. Earlier, Selena was talking about it doesn't just affect you as the mother, but every single person that is around you. And your husband, I believe that he bore the brunt a lot when it comes to, he bore it a lot. He carried the weight, everything. And he did so well with supporting you. I just want you to brush on the surface a bit when it comes to the level of support that you got.
Okay, so first of all, I just want to thank God first. The medical team at NICU and KMC, they did so lovely. And then my husband, because as I said, I'd logged out already. I didn't want anything to do with it, but he kept me going. He gave me hope. The baby was going to be fine. The baby was going to be fine.
Yeah.
Wow.
And then from there to, at every appointment, he was there. Days that I said I'm not going to hold the baby, he was there.
Yeah.
Like he would hold the baby, because KMC, he would come there every day. There were days that I said he should go home. He said no. There were days that he would come, put the baby in his shirt, like the way we do the kangaroo.
Yeah.
He'll still be there for me. Yeah. I had my sisters coming in, my sister's children, they came in, my mother coming in and day out. So it felt like at that point, everybody has to be visiting you day in and day out. And we have spent almost 2 to 3 weeks at KMC alone, and about a month at NICU. So even everybody will be affected, friends, family, everyone is going to be affected.
Yeah.
But one thing I appreciate, that I had my husband, I had my mother, I had my sisters, and I had my sister-in-law, and I had my friends, my husband's friends. They were there.
Look by extension, the friends.
They were there.
Wow.
Her husband's friends were there.
Yes, they were there. They even came to visit me, made fun. Even though they were playing games, they knew that I was not even excited, but it was still like...
We'll force you to be excited.
we'll force you to eat, we'll force you to play and all of that. And after the interview, they called, were like, Nancy, you made me theory. You still come play with us, and you were going through all of this thing. I'm like, it's because of my husband. Because when we are going in, he said, everything will be fine. The baby will be fine. You don't have to cry for everybody.
Yeah.
So this morning when we were coming, he said that I don't want you to go and cry or nothing. No crying. I'm like, yes, yeah, no crying. So we are good. Baby is fine. And then before she touches on the purple basket, I just want to say something little. During my time, we had mothers at the board that even common diaper, they could not afford. I remember sharing some of my things with a mother, Teresa, wherever she is. I remember even water, because you cannot use ordinary water for the baby, bottled water, like you have to. And she could not afford it. Do you get me? So the purple basket, when I saw the project, I was like, our time, like last year, if mothers had, there were a lot of things in the purple basket. When I saw the videos, diapers, wipe, and just diaper. When you get to NICU, the first thing they ask is diaper, wipe, and tissues. And if you can't afford it, that minute, you are gone.
Oh, God.
So I encourage that we would all support the purple basket.
Yeah.
Please and please. Just, I think the 50 pieces inside is like 85 Ghana cedis or so. So we can do more for them. I'm pleading with everybody, the public and everybody, kindly support the people.
And this morning, I want us to do something very special. Please, clap. Put your hands together.
We are clapping.
We are clapping for everyone that is called Yao. Can I have Yao here? Clap for all Yaos. If you're Yao, the Yao that is representing you people now has done something special. And we are happy for him.
Yeah.
Oh boy, look at the young man. Yo!
So guys, so Yao, this is Yao Nani. Yao is the husband of Nancy.
Yeah.
And that is our baby
Ciao.
boy.
There you go. I got you. How are you?
Don't cry.
Oh boy.
You go to his father, you be
See, your swag is not from here. Up there, right? And he's got my hair. Good to see you. Stay here for a while.
Hi, Yao. Good morning to you.
Morning.
Hope you're well.
Fine.
Come.
You want to go to mommy?
Yeah.
Okay.
He does. He
She carried
does.
you. It's fine.
Yeah. Yao, KMJ. Man to man.
I don't know how many men will stay or how many men will even accept the fact that they have to go through all of that.
Yeah.
Even by extension, your friends were there for you.
Yes.
You may have done something special.
Well, I don't even call them my friends. They are more than
Family.
a friend. Yes, we are family. I mean, you should see us every Sunday after church. We meet together, we eat together before we all go back to our various places. So they are more than a friend. They've been there through thick and through. I mean, they gave us the support. Even though at a point, because of Nancy was emotionally, unstable, I had to
drag out.
But you did well, though.
Strategy.
Yes.
You did so well. Per what she told us from last week.
Yeah.
I don't know how many men would. The moment she logged out, where she said that, she had given up, she knew that there was nothing else to be done.
Yeah.
You were that positive affirmation, that optimism, that... yeah. The other door. The other door. Selena, you want to chip in something?
Yeah, I mean, the experience Nancy and the husband Yao is exactly what we keep advocating for.
Yeah.
A couple of years ago, we were out. I joined a team in some rural areas, and something interesting happened. The nurses drew my attention to a woman who had breech presentation. Now, breech presentation is when the baby's head is descended. The leg has rather descended to the birth canal area, even though the woman is due to have a baby. So it's supposed to be the head. So after, but it was the leg rather that had come down, and that meant that the woman is at risk, the baby is at risk. They must prepare the woman for an emergency cesarean after they observed for a while. And the story was that this man had refused to sign for the nurses to transport the mother to Confanoche. And his reason was, tell them to bring me a letter before I would sign. And it's a farmer in the cocoa area. He's rich in the area. And when they told me, somehow I couldn't be upset. I moved to this man. I said, in our local language, I said, Eja, Maho, we dey utinko be mena, why are you? It's like mommy. And this man was giving me attitude because everybody has been, talking bad about him. So he was just ready for me. And I said, why are you utinko? Be kakra na nyame asye yesi nyame asye mommy ne say problem kakra wo ho. And I said, so what do you think we can do? Long story short, this man was about to be defensive until I said, I know that you might be going through a lot. You don't feel appreciated for all that you are doing. Oh. And you are making sacrifices that nobody has seen yet. Yeah. But we know. Maybe things are going on between the two of you that you can't even explain to anybody. Nobody understands you. Yeah. But you don't know what will come out of this baby. Maybe this is the baby that will wipe away your tears and restore the dignity that you desire. So let's do everything possible to save this baby. In case he doesn't even make it, Enka say, my dad fought for me. Yeah. And once I said this, the man just heaved a sigh of relief. Oh. I said, let me know how I can help. And he said, what can Mati? I got a call the next morning that the man paid whatever he had to and made arrangements for the wife to be taken to Kofanoshe for safe delivery, and the woman was okay. My point is, we need to create a safe space for more men to participate in issues around women and child health. Men will protect, will provide when we give them the space and change the narrative a little bit to encourage them to be part of it. A lot of them are abandoning the babies not because they want to. Some are doing it because they are afraid. Yeah. Their way of showing fear is abandoning. The way of showing that they feel less of themselves because they can't provide is running away. Ooh. So instead of using the negative narrative to push them away, encourage them. Offer them support. Say, how do we help? So the facility, collaboration with the healthcare facility, let's do more to make it easier for male participation because they are our bodyguards. When they know how to help, they will give you everything as much as possible. And so this story should be celebrated. In fact, we should be able to continue some of these conversations so that more men will be able to come out and share their stories and make it easier for others to share their own. We might be celebrating, but he alone knows what it meant, the courage it took for him to look at his baby, look at his wife, and say that I'm going to brave up. He would probably have to tell us the truth that a woman would
he did.
I just called it. Whenever I get to the hospital, I give you an update. Like, oh, okay, there are prescriptions. Let me go and get the medicine and come back. So there was one Thursday I got there, the way he was looking. Anytime I get there and I get close to the incubator, he opens his eyes. And the nurse would be like, hey, father's connection. So he just open his eyes, smile, and go back.
Wow.
So that day, that Thursday when I got there, I just called Nancy. I was like,
today,
baby, and then the cry. And she was like, why? I was like, when I come home, we'll talk. So that day was just off.
There's always that moment.
It was just off for me. But I mean, with God, He saw us through.
I mean, you can't even tell. You know, like, he's so handsome. What's the name you mentioned last week?
Nokuno.
Nani. Nani. Oh,
that Thursday was the day my dad named him.
The miracle.
When I informed him about the situation, it was like, miracle. I was like, no, his grandson wouldn't.
And that's a miracle baby right there. Look at him having his good time. So, how do people support you? Because you can't do this alone.
Oh, yes. I mean, first, I know we've sent thank you, but we have to say a big thank you to the healthcare professionals. We need to give them their flowers. A lot of doctors and nurses wear their hearts on their sleeve. A lot of them. And we've had opportunity to work with a number of them, Dr. Braco, a lot of them. So wherever you are, if you're a medical professional, a nurse, a doctor, whatever you do around our newborns and our mothers, we want to say thank you, our gynecologists, and also to the healthcare societies. We had support from PSG, Society of Gynecologists and Obstetricians, GRNMA, and Ghana Psychological Association, who joined the campaign, because the psychologists came here. Obstetrics and gynae came here. This was their way of supporting, by giving a resource for people to support what we are doing, the awareness campaign. So to how you can support, first, that you follow us on our social media so that you can help spread the awareness. The more we know, the more we can make better decisions and offer support. The second is to look out for activities that we will be implementing from now until the next year, November. We will not be resting. God give us the grace and the strength, and with the necessary support, I'm sure we'll be able to continue, because if we keep quiet, trust me, we'll come back next year with the same story.
That's true.
But if you can support every way possible, it means that we will continue to conduct this advocacy. Now, with the Purple Basket, we provide essential items for mother and baby in the NICU. This is what you don't realize. NHIS covers less than 10% of the actual cost. Some mothers have to pay for oxygen out of pocket. And the lab expenses and all of that, they have, some of them, majority of them pay out of pocket. And that burden, I'm sure you also confirm that.
A lot.
A lot is out of pocket. And so Purple Basket's idea here is an intervention that whilst we are advocating with government to increase investment, that's a whole long process. But in the meantime, how do we shoulder the pain of these families to make sure that we reduce the abandonment? Because a lot of babies are abandoned by their families because they can't afford it. So so that whatever you do with it. And we heard on the Joy News National Dialogue that the cost of care is a deciding factor on who survives.
Yes, it's a fact.
So we want to make the burden easier. I started 9 years ago. I made, out of my personal resources, 4 Purple Baskets for 2 mothers and 2 babies. And since then, through support of individuals and organizations, we have distributed more than 10,000 Purple Baskets to over 20,000 babies and families in 7 regions of Ghana. And so we want to continue doing this. There's no end to this. Each basket costs us about 1,500 to put together, because it lasts them that long. The logistics and everything that we need to do to distribute this. And so if you're a company, this is something you can adopt as your corporate social responsibility. If an individual, the Momo numbers will be displayed.
Okay, can we have the numbers on the screens?
Yes,
if we have
the bank details as well. And if you're an individual and you want to support this on a monthly basis, weekly basis, maybe on your birthday, you want to do something, please reach out to us on the numbers displayed on your screen, on our social media as well, and our emails. And you can send in your donation easily, just on the Momo number that will be in the bank account. And you can support it, however small. Each basket is for one mother, I think for a mother and a baby. That's how we package it. And we source from the best to make sure that we show respect to our babies and our mothers, even though we are giving them as support.
Okay, so the details are currently on your screen. The number is 05577940040. If you want to do a bank transfer, those are the details. Bank name is First Atlantic Bank, or you want to do a mobile money transfer, the MTN number is 0555093697, and the account's name is African Foundation for Premature Babies and Neonatal Care. This is laudable. This is beautiful. I love the fact that we are not stopping here. We are not ending here. Usually when the month ends, then it means that everything has ended. But I love the fact that you're still pushing forward regardless, and hoping that next year by this time, God willing, we'll see more improvement when it comes to preterm babies and mothers, supporting mothers and all that. So, our baby is... Anyway, so yeah, but... Thank you so much, Salina. Thank you so much for all that you're doing for these mothers.